Here's a startling statistic. More than 1.5 million people will be diagnosed with cancer this year, and that's according to the American Cancer Society. And catching cancer early is the key to treatment. Here to bring us life-saving information about 4 important cancer screenings is Dr. John Jacob. He is with Gulf Coast Medical Group. Thank you so much for coming today.
Thanks for having me.
We want to know what these are, because if you can find it early, then it's not such a big problem.
Absolutely. The key to cancer screenings is doing it early. And because if you can pick it up early, then you have a greater chance of curing it.
So since you don't know what you're screening for, just have all of the things screened. That's my
Yes.
theory. That's my theory. Well, let's start with breast cancer.
Yeah.
This is something women need to do.
Absolutely. Breast cancer is one of the leading cancers in terms of how frequent it is. So in terms of when you want to be screened, you want to start at the age of 50.
At the age of 50.
At the age of 50. And there's different guidelines in terms of different agencies that we have in terms of when we should start. As family physicians, we go by the United States Preventative Services Task Force. They say at the age of 50, we should screen. And it's usually every 2 years up until the age of 74. But oncologists have their own deal. Gynecologists have their own deal in terms of when they want to start. That's why it's important to have a conversation with your healthcare provider in terms of when you should actually start. But from a family practice standpoint, it's age 50.
Does family history affect that?
Family history is everything. So, like I said, it's a big risk factor for breast cancer and all sorts of cancers, family history. So usually, if there is a family history component to it, you want to start actually at age 40.
So a little earlier.
Very
so,
good to
so a little
know.
bit earlier.
You might not
Absolutely.
think of that.
Absolutely.
Now, cervical cancer.
Yes.
That scares me.
Yes. So we usually start at the age of 21. And this is also going
21?
21. The old guideline was starting at the age of 18 or 3 years after your first sexual encounter.
Oh, wow.
Those guidelines have changed. Now it's 21, and you can actually go every 3 years in terms of getting your pap smear, up until the age of 30. And then at the age of 30, if you do the pap testing along with HPV testing, and HPV stands for human papillomavirus, which is the virus that causes cervical cancer, if you do both of those together, you can actually extend it to every 5 years. Most gynecologists still do pap testing every year. So that's why, like I said, family practice, we have our own guidelines. Gynecologists have their own guidelines, so you have to have a conversation with your healthcare provider in terms of when to do it.
But
So.
cervical cancer is really something you want to avoid at all costs if you can.
Absolutely. It's we only have 4 different cancers that we have preventative screening tools, and cervical cancer is one of those. So you have to do it. We definitely recommend it. So,
Absolutely.
yeah.
And colorectal screening.
Colorectal cancer, we start that at the age of 50. And depending on what is shown on the colonoscopy report, if it's a normal colonoscopy, you can go every 10 years. But if, like I said, there's a family history, then we usually start at the age of 40, and they will do colonoscopies every 5 years if there is a family history of it. But for the general population, at the age of 50.
I had one when I was about 60,
Yeah.
and they did find a lot of polyps.
Did they?
Said this could have led
Yeah.
to, actually could have led to death. And
Yeah.
they had them, I had them removed, and then I had the screenings. I am polyp-free.
There you go.
All problems erased. That'll never be a problem in my life.
Very good.
Just because I had those screenings.
The thing is, my wife, she's an oncologist, so we kind of say, I screen them and she treats them. You don't want to go to her. You want to make sure you get your screenings done so you can avoid
And
going
we
to the
get so
oncologist.
nervous sometimes to ask about cancer. It's just, you know, there's still that fear to even bring it up with your doctor. But
Right.
the point is,
It's a device that we have, screenings are a device that we have to prevent death. So you should absolutely get them done. So it's a big take-home message. As family physicians, we have our hands in a bunch of different jars. We look at blood pressure, we look at diabetes. Obviously, cancer screening is a big part of the patient encounter, and these are life-saving techniques.
Wow.
Lung cancer. We haven't talked about that, a lung screening.
Yep, that's actually a new recommendation. So breast cancer screenings, colorectal cancer screenings, we've had that for quite some time, but as of the last couple of years, now you can actually screen for lung cancer. So if you are between the ages of 55 and 80, and if you've smoked for 30 years, like a pack a day for 30 years, you can do something called getting a low-dose CT scan. That's a yearly thing. To detect for lung cancers.
I've known so
between
many
the age of
people that
55 and 80. Yeah.
wish that had been available.
Yeah.
This is great to have
Yeah,
it.
and that's a new recommendation. So not a lot of patients know about that one. So that's important to know.
So be sure and mention that
Prevention
one.
is key.
Prevention is key.
Thank you so much, Dr. Jacob.
Absolutely,
He
thank
is
you.
with Gulf Coast Medical Group.net. Be sure and get these screenings. They can save your life. We're going to the kitchen and have, what, cold noodles with tsunami? Whoa, that sounds good.